Good day, everybody. How are you doing? Today, we are going to talk about design of experiments, and I will share my computer screen with you. So this section is on design of experiments. Distinguish between a randomized experiment and an observational study. So experimental units are individuals who are studied. There can be people, animals, plants or things. When the experimental units are people, they're sometimes called subjects. So we collect information on people. Okay. The outcome or response is what is measured on each experimental unit. Treatments are procedures applied to each experimental unit. So experimental units are called subjects when they're people. On them, treatments are applied and we measure the outcome. What are treatments? Procedures we apply to each experimental unit. Scientists who want to uh, determine which of three types of seed will result in the largest wheat yield prepare three identically sized plots of land with similar soil types. So plots of land are the experimental units. Plant each type of seed on a different plot, choosing plots at random. Okay, so these are the treatments. So experimental units are plots of land on which you're applying treatments, which are types of seed. Water and fertilize the plots in the same way. What happened? कि खबर जाती नीचे नहीं है मैं रिकॉर्ड करती हूँ जाए everything. Okay, bye. Scientists want to determine which of the three types of seed will result in the largest wheat yield. The study is conducted as follows. So you have experimental units, which are plots of land. You have treatments, which are the types of seed, plants each type of seed on a different plot, and water and fertilize the plants in the same way. Okay. So harvest the wheat and measure the amount of wheat grown on each plot. So that's your outcome, results, amount of wheat grown. If one type of seed produces substantially more or less wheat than the others, then that one is clearly better or worse than the others. Okay. What is a randomized experiment? Is a study in which investigator assigns treatments to experimental units at randoms. To assess the effectiveness of a new method for teaching arithmetic to elementary school children, a simple random sample of 30 first graders were taught with the new method, and another simple random sample of 30 first graders were taught with the currently used method. At the end of each week, the children were given a test to assess their knowledge. Notice there are two groups, and children in these groups are randomly selected. For example, in the first group, a simple random sample of 30 first graders were taught with the new method. And then another simple random sample of 30 first graders were taught with the currently used method. Okay, so there are two groups. One is the current method, and another, one group in which 30 students were randomly selected. They were taught with the current method, and the other group, which was also randomly selected, 30 first graders were taught with the new method. At the end of 8 weeks, the children were given a test to assess their knowledge. The treatments in this experiment are two methods of teaching. This is a randomized experiment because children were assigned to treatment groups randomly. Observational study is in one in which assignments to treatment groups is not made by the investigator. A study is performed to determine how smoking affects people's health. A group of smokers and a group of non-smokers are observed for several years. Scientists observe differences in health outcomes between the groups of smokers and non-smokers. Notice there were no treatment given to these experimental groups. Okay, they just observe the smokers, they just observe the non-smoker. Because the assignment of treatments, smoking or non-smoking, is not made by the investigator. This is an observational study. Understand the advantage of randomized experiment. In a perfect study, treatment groups would not differ from each other in any important way, except that they receive treatments in practice. In except they receive different treatments. Okay, so they would be perfectly similar, and they will just receive different treatments. That's a perfect study, but that's not going to happen. In practice, it is impossible to construct treatment groups that are exactly alike. But randomization does the next best thing. Randomization in this case means you randomly select people and put in the two groups. One group, for example, in the previous example, one group got the current method of teaching, the other group got the new method of teaching. But people were randomly selected in those two different groups. In a randomized experiment, small differences among treatment groups are likely due to be only chance. If there are large differences in outcomes among treatment groups, we can conclude that differences are due to the treatments. Scientists reported the result of a study to determine whether a new drug called raltegravir is effective in reducing levels of virus in patients with HIV. Those patients were divided into two groups, where one group was given raltegravir and the other group was given a placebo. Placebo is a sugar pill that looks exactly like the actual pill without the medicine in it. In the raltegravir group, 62% of the subjects had reduced level of virus, but only 35% of the placebo group did. Because this study was a randomized experiment, what does it mean? The two groups were randomly selected. It is reasonable to conclude that the difference was actually due to raltegravir. Double-blind experiment. An experiment is double-blind if neither the investigator nor the subjects know who has been assigned to which treatment. So the investigator means the people who are conducting the experiment, they do not know which people have been assigned to which group. Plus the individuals themselves who are participating in the groups, they also do not know whether they're in the group getting the actual medicine or the group getting the placebo. When investigators or subjects know which treatments is being given, they may tend to report the results differently. Therefore, experiments should be double-blinded whenever possible. In a completely randomized experiment, there is no restriction of which subjects may be assigned to which treatment. In some situations, it may be desirable to restrict randomization a bit. This can be accomplished with a randomized block experiment. So, imagine two reading programs are to be tested in a school that has children in grades 1 through 4. If children are assigned at random, it is possible that one of the programs will end up with more fourth graders. And since they tend to be better readers, this will give the program an advantage, that program an advantage. This possibility can be avoided by randomizing the students within each grade separately. In this grade, in this experiment, each grade, that means grade 1 is a block, grade 2 is a block, grade 3 is a block, grade 4 is a block. And the subjects within each block are randomly assigned to a treatment. So grade 1 is divided into two groups randomly. So randomly students were put into two groups. Okay. And one of the groups in the grade 1 block will get the regular method of teaching. The other grade block who are randomly selected will get the new method of teaching. For example, reading skills. So you are randomizing inside the blocks. What are the blocks? The blocks are the grades separately. Grade 1, grade 2, grade 3, grade 4. Within each grade, you're dividing them randomly into two groups. One group gets the regular, the other groups get the new method of teaching. This is called a randomized block experiment. Understand how confounding can affect the results of an observational study. Imagine an observational study intended to determine whether smoking increases the risk of heart attack. A group of smokers and non-smokers are observed for several years, and during that time, a higher percentage of the smoking group experiences a heart attack. One problem with this type of study is that smoking group will differ from non-smoking group in many ways other than smoking. Okay. For example, smoking is more prevalent among men. So the smoking group will contain a higher percentage of men than the non-smoking group. Okay. Men generally are at higher risk of heart attack than women. Therefore, the higher rate of heart attack in the smoking group may be due to the fact that there are more men in the smoking group and not to smoking itself. Notice we have not controlled anything. We just observed a smoking group and a non-smoking group. What they're saying, the smoking group will have more men. Okay, because men are more smokers. And it is generally known men have more heart attacks. So if in the smoking group we have more heart attacks, it may be because the subjects are more men in that group, or it may be they're smoking. So smoking and gender, they're confounding each other. Confounding means confusing the results, final results. A confounder is a variable that is related both to the treatment and the outcome. When a confounder is present, it is difficult to determine whether differences in the outcome are due to the treatment or to the uh, or confounded. In the smoking example, gender was a confounder. More men smoke. Gender is related to smoking. More men are more likely to smoke and also to heart attacks. More men have heart attacks. Okay. Men are more likely to have heart attacks. For this reason, it was impossible to determine whether the difference in heart attack rate between men and women was only due to smoking or because it was of gender. Okay. In an observational study, the effects of blood pressure, a large group of people of all ages were given regular checkups for a period of 1 year. It was found that people with high blood pressure were more likely to develop cancer than people with lower blood pressure. In this example, age is likely a confounder. Older people tend to have more high blood pressure, and older people are tend more likely to get cancer than younger people. Therefore, people with high blood pressure may have high cancer rate than younger people. Okay, even though high blood pressure does not cause cancer. Okay, what is going on here? You have found out that people who have high blood pressure have cancer. Okay, but who have high blood pressure, tendency to have high blood pressure is older people, and older people also have a tendency to have more cancer. Okay, so you do not know for sure that whether high blood pressure is causing cancer or not, because age is confounding the result. To study the effect of air pollution on respiratory health, a group of people in a city with high levels of air pollution and another group in a rural area with low levels of pollution are examined to determine their lung capacity. Is this a randomized experiment or an observational study? Of course, this is an observational study because we have not controlled any of the experimental factors. It is known that drinking alcohol increases the risk of contracting liver cancer. Assume that in an observational study, a group of smokers has a higher rate of liver cancer than a group of non-smoker. Explain how this result may be due to confounding. People who smoke may be more likely to drink alcohol than people who do not smoke. Therefore, it might be possible for smokers to have high rate of liver cancer without it being caused by smoking. Describe various types of observational studies. Observational studies can be divided into two. The first one under the observational study is cohort study. The second one under the observational study is case control study. Further, cohort study can be divided into three groups: prospective, cross-sectional, and retrospective. There are two main types of observational study: cohort studies and case control studies. Cohort studies can be further divided into prospective, cross-sectional, and retrospective. In a cohort study, a group of subjects is followed. So cohort because this a group of subjects who determine whether various factors of interest are associated with an outcome. So cohort means a group of subjects who are studied together. A prospective cohort study is one that subjects are followed over time. So group of people, same group of people followed over a period of time. One of the most famous prospective cohort studies was the Framingham Heart Study. This study began in 1948 with 5,209 men and women from the town of Framingham, Massachusetts. Every 2 years, these subjects were given physical exams and lifestyle interviews, which were studied to discover factors that increase the risk of heart disease. This is cohort study for sure, prospective because you follow them over a period of years. A cross-sectional cohort study is where measurements are taken at one point in time. Eilang and colleagues studied the health effects of bisphenol A, a chemical found in the linings of food and beverage containers. They measured the levels of bisphenol A in urine samples from 1,455 adults and found that people with higher level of bisphenol A were more likely to have heart disease and diabetes. But it was done at one point of time, so it's a cross-sectional cohort study. And a retrospective fall behind. Subjects are sampled after the outcome has occurred. In a study published in the New England Journal of Medicine, T. Adams and colleagues sampled 9,949 people who had undergone gastric bypass surgery between 5 and 15 years previously. So the surgery has happened 5 and 15 years previously. Retrospective, you're going back along with 9,668 obese patients who had not had gas bypass surgery. They looked back in time which patients were still alive. They found that the survival rates for surgery patients were greater than for those who had not undergone surgery. So retrospective because you're looking back as to the point when these people had the gastric bypass surgery. In a case control study, two samples are drawn where one consists of the people who have the disease of interest, the cases, and the others who consist of people that do not, the controls. The investigators look back in time to determine whether a factor of interest differs between the groups. S.S. Nielsen and colleagues conducted a case control study to determine whether exposure to pesticides is related to brain cancer in children. They sampled 201 children who had been diagnosed with brain cancer. So this is the case. And 285 children who did not. This is the control group. They interviewed the patients to estimate the extent to which the parents to estimate the extent to which the children had been exposed to pesticides. They did not find a clear relationship between pesticide exposure and brain cancer. In a study conducted at the University of Southern California, J. Peters and colleagues studied elementary school students in 12 California communities. Each year for 10 years, they measured the respiratory function of the children and the levels of pollution in the communities. Was this a cohort study or a case control study? This is a cohort study, followed a group of children. Was this study prospective, cross-sectional, or retrospective? Prospective because you followed them over a period of time. In a study, J. Rattenberger and colleagues studied people who had worked at the Rocky Flats nuclear weapons production facility, who had worked in the past, retrospective, looking back. They studied a group of workers who had contracted lung cancer and another group who had not contracted lung cancer. They looked at the amount of radiation exposure for each worker. The purpose was to determine whether those with lung cancer had been exposed to higher levels of study. Okay, so this is a case control study because the case are people who have lung cancer and the control is those who do not have lung cancer, the group that did not have lung cancer. Was this study prospective, cross-sectional, or retrospective, looking back to the time when they worked in that plant? So it's cross-sectional, not cross-sectional, it's retrospective, means looking back. Okay. So I'll stop here today. If you have any question or comment, please write me a note. I'll respond to your comment immediately. And also, if you like this video, please share with your friends. If you like this video, please give me a thumbs up. I appreciate that. Please share with your friends, and you and your friends, please subscribe to my channel by hitting the red subscribe button and let YouTube know to notify you every time we upload a new video, which happens quite often. Please do not forget to watch me tomorrow when I'll be back with another interesting topic. Thanks for watching. Take care. Have a nice day.